Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic-related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan, and we're here with our guest today, Dr. Nick Hartop out of Chesterfield, Michigan. Good to have you with us.
Thank you for having me.
So I would like to talk to you first a little bit, Doc, about how you got into the profession and your story coming into chiropractic.
Gladly. I started off, actually, I was in the Marine Corps back in the 80s, and of course, the kind of training and all the kind of stress that we put on our bodies, I was having from neck pain to back pain, things like that, and I had a friend of mine that basically said, you should see my chiropractor. Back at that time, it wasn't as accepted as it is today with chiropractic care. They kind of shunned it. So I didn't say anything. I just went because they were giving me basically Motrin for every problem that you would have. You go in a sick bay, doesn't matter what happened, here's the Motrin. Anyhow, I started seeing this chiropractor, and all of a sudden, a lot of these problems started going away. But more importantly than just the neuromusculoskeletal type of issues that I had, he found that I was lactose intolerant. Nobody else told me that, and I grew up very sick. My mom is a registered nurse, and of course, you got a problem, got a pill kind of mentality. And again, I had stomach pains growing up, allergies, asthma. I had all those issues going on, and never seemed to get it resolved. And then all of a sudden, I'm seeing this chiropractor for back pain, but then all of a sudden, these other things started clearing up. I said, well, wait a minute, what is that you're doing that other people aren't doing? So I really got interested in it to the point where I decided I want to do this.
And that's something really cool that we see a lot in our profession. Is we see a lot of side benefits, where you always hear, with the commercials you see on TV for all the different drug commercials, all the side effects, where in chiropractic we see a lot of the opposite. We see a lot of side benefits. We see a lot of people that come in for their aches and pains, and next thing you know, they feel that they have a lot more energy, or they feel that they sleep a little better, or that they breathe a little better, or that they're more athletic. We see that a lot in our profession, which is something really cool.
Mm-hmm.
And along the line of what you're talking about, being in the Marine Corps, we see now more and more veterans, more and more people in the armed forces, and in fact now the VA is a big supporter of chiropractic care and covers chiropractic care throughout the country, which 20 years ago didn't happen, but now they've realized that chiropractic care is so beneficial for people in the armed services that that every VA has chiropractors that are under their area, and they refer to the chiropractors. I take care of lots of people myself all the time through the VA, and get the referral, and some of them even have chiropractors on staff at a lot of the VAs now.
Right. Yeah, absolutely. I just in the past 10 years, I've seen such a dramatic change. I actually was in a pretty bad accident. I was at the U of M in Ann Arbor, and it's associated with the VA clinic there. And so all my doctors were U of M doctors, and when they heard that I was a chiropractor, I don't know, I just felt like I got treated a little bit different in the sense that, in fact, the one time when I was talking with this doctor that had been practicing 50 years, I was questioning his methods, his direction. It didn't make sense what he was prescribing. And so I questioned it, and I mentioned to him, well, I'm a doctor, and he knew I was a chiropractor. He said, well, okay, Mr. Hartop. I mean, he kind of really put me down. And I had 8 other doctors, interns that were there. And so I decided, well, okay, you're the doc, you've been practicing all these years, I'll just let you do your thing. Well, a week later I was back in with a staph infection, which I suspected, and that's what I was saying, that there was possible, that was happening. And of course I checked my blood work, and it was all positive for that. They never said anything. And do you think I ever saw that doctor again?
Wow, that's terrible. Never
saw that doctor ever again. Never said, I'm sorry, you were right, I was wrong. Never again. And so it made me realize, if somebody's been doing something for so many years, you don't want to just decide, just let them say what they're going to say and just like, okay, you're right, I'm wrong, because you have so many years experience. You really have to
And that's something
stick to your guns.
That's something that I urge patients to do throughout the community with anything as far as healthcare. I urge them to question me. I urge them to question any of their healthcare providers.
Right.
It's funny that people think more about their house than they do about their body. You know, when they're going to get a quote on having their basement redone, they get 3 quotes. They ask everyone around. They Google everything they can about this particular project. They want to make sure it's going to be the right price. They're going to make sure they're going to talk to people that have used this particular carpenter or this particular handyman before, or construction crew. They want to find out testimonials about it. When it comes to their health, they just talk to one doctor, take it blindly. You know, so I always urge them to get second opinions. There's nothing wrong with getting second opinions. There's nothing wrong with talking to different types of doctors. There's nothing wrong with talking to the same type of doctor, but multiple of them. You know, nothing wrong with getting copies of their x-rays, talking to every doctor, talking to some of their patients that have survived the surgery and have loved the surgery, talk to some of them that haven't. They really should focus more on their body than they do on the house. But, you know, it's always 3 quotes for a house. It's never 3 quotes for their body. People go in, you know, first opinion, have a surgery, first opinion, have a procedure, without talking to anybody else about it.
Right. Even with chiropractors, somebody will go to one chiropractor, and they may be, and there's many different techniques. Some people like a more aggressive type of adjusting technique. Others like a very light, like an activator, an instrument type adjusting, soft tissue work. There's many different ways. And they'll go to one particular chiropractor and have an adjustment and decide, you know, I didn't like that, didn't have a good experience, and they won't go back and they won't go anywhere else. And they have that opinion about the whole profession. And that just surprises me. It just really baffles me sometimes.
Unfortunately, they don't say, I didn't like that chiropractor. They say, I didn't like chiropractic in general. Right. If you have a bad auto mechanic, doesn't mean you're never going to get your car fixed again. You go to the auto mechanic, you didn't like him, you find another one. You have a plumber that had a bad experience with him, you get another plumber to fix your problem in your pipes. If you have a chiropractic problem and don't like the chiropractor you saw, it's absolutely okay to seek another chiropractor. There's lots of different approaches, lots of different techniques. And so unfortunately, a lot of people rule out chiropractic as a profession and as a healing entity rather than finding the right chiropractor for them. And so I want to urge people in our audience that if they've been to a chiropractor and had a bad experience, don't give up on chiropractic as a healing art and as a profession. Find another chiropractor that may be a better fit for them.
You may need to go through a couple different ones. I have no reservation in referring somebody to another type of technique, especially with specific ones like Atlas orthogonal, Nuka, Toggle, which are names for very specific upper cervical adjusting techniques, which there was a saying in college I used to love because I was really big into Toggle Recoil is the name, upper cervical. It says, when all else fails, toggle.
Yeah, I like that technique myself too. Yeah. And I'll explain to our audience what toggle is. It's a certain type of technique. And again, there's dozens of different chiropractic techniques. So this particular one uses a drop table headpiece that as the table drops down, oscillates the very top bone in the spine called the atlas. And the atlas is a very important bone in our spine. If you think of the Greek mythological god, Greek god, Atlas, he holds up the world. And our Atlas does the same thing. Our Atlas actually sits right at the top of the spine and holds up our world, holds up the skull. The whole skull is like the world here. And when this Atlas is in proper alignment, the brainstem comes right through the center of the Atlas. When it's out of proper alignment, there can be interference or pressure at the brainstem area, or even can cause inflammation that can cause interference there at the top nerves at the brainstem area. And so we want to make sure we keep this Atlas at normal alignment. So a toggle recoil, the patient will lay on their side on a drop headpiece, almost like a little lift. So the headpiece comes up, and as we drop the headpiece down, we oscillate the Atlas at just the right angle to restore normal function in the brainstem area in the Atlas. And it's a very powerful adjustment. It's a great adjustment. Oftentimes, it will be the only adjustment that people will do.
Absolutely. There's a very specific table for that. I know some people that actually do the adjustment for a toggle with a regular table, but it really isn't designed for toggle because there's a special piece that supports the head in just such a way. And I just found that to be, also with Atlas orthogonal, a special table for that. So you have to have the right tools for the job. You know,
absolutely,
just
absolutely.
Like anything else.
And so I know, Doc, you definitely have some different insight than a lot of people on the chiropractic techniques because you've got kind of a niche in the chiropractic profession yourself, doing a lot of fill-in work at all sorts of different offices, dozens of offices all around the state.
Yes, actually, been doing that for 17 years. Actually, before I got into chiropractic, I was in the service. After I got out and I was going to school, I was working at temp agencies. for some reason, and I just seemed to get into the groove with doing that. I like moving around. I didn't like to stay in one place for too long. And so anyhow, it just kind of worked out that when I got into chiropractic, I came here to Michigan, and I had a friend of mine that I went to school with, and she was going out of town for 2 weeks and didn't want to shut her doors and say, hey, can you help me out? So I did, and I actually liked it. And then she referred me to other chiropractors, and next thing I knew, I was getting calls all over the southeastern Michigan, actually all over the state, but I would only take care of the people in southeastern Michigan, and it just exploded. And so I've been doing it ever since, and I absolutely love it.
That's really cool. So you can see lots of different types of practices, lots of different types of techniques. So we're going to take a little break for a second here. We're going to show a video, and this is a video, basically a nice intro to chiropractic care, some cool special effects, and we want to show the video now. We'll talk about it a little bit afterwards.
Ready for a pop quiz? What part of the body transmits impulses at a speed faster than a race car? It's the central nervous system. Follow-up question, your nervous system is comprised of the brain and spinal column. This is the human brain. Well, not this specifically, but it looks a lot like this. The human brain is a very busy organ, especially right now, as you're both watching and listening. And this is the spinal cord. It's also pretty busy, employing more than 12 billion neurons that help the brain funnel signals through a delicate bundle of nerve fibers. These fibers get progressively smaller as they branch off to all parts of the body, including your heart, lungs, stomach, muscles, and skin, even parts you don't use that much. These signals travel through your body like traffic flowing on a busy highway. The nerve fibers are housed and protected by your spinal column, a strong yet flexible structure composed of 24 individual movable units, the spinal vertebrae, and the shock-absorbing intervertebral discs. These help to give the spinal column three-dimensional movement and flexibility. Our flexible spine has an amazing and intricate design that allows us to dance a tango, take a jump shot, and even do a backflip, although not always perfectly. Now imagine that same highway we saw earlier after an auto accident, a colossal traffic jam. The same thing happens in your body when there's interference with the nervous system. If left untreated, the traffic jam of a pinched nerve can lead to symptoms, pain, and disease. The chiropractic term for this combination of events is vertebral subluxation complex. But if it's okay with you, we'll just call them subluxations. Spinal subluxations involve nerve root compression. In the early stages, this compression can exist without pain, commonly referred to as a silent subluxation. But if the subluxations are left untreated, degeneration can set in. And then, oh yes, there can be pain. Degeneration can lead to an abnormal curvature of the spine, bone spurs, and other structural and neurological problems. These, in turn, can contribute to a variety of complications as diverse as headaches, asthma, allergies, menstrual issues, sciatica, chronic tiredness, and abnormal sleep.
My first birth was very difficult. I had sciatica, and I was on bed rest after about 6.5 months because of this shooting pain when I'd walk. The doctor told me to expect sciatica for every pregnancy, and I couldn't accept that. So with the second pregnancy, I enrolled in chiropractic care, and I was on my feet till birth.
Most of the time, subluxations result from the stress and strain of ordinary life rather than from specific events. Activities like sports, improper lifting, computer work, pregnancy, stress, and lack of sufficient rest all contribute to subluxations. After all, having greater flexibility comes at a price, the possibility of injury. Enter your local friendly licensed chiropractor. Through gentle hands-on treatment, chiropractic care locates, analyzes, and corrects misalignments with a series of spinal adjustments. While there are several techniques used to correct nerve interference, the goal is to optimize your nervous system so it can function like the free-flowing, multi-directional, high-speed human freeway system it was built to be. So by correcting spinal misalignments and removing nerve interference, the brain's nerve impulses flow freely, mobility is restored to the spinal joints, and most people enjoy relief from pain, increased energy, and a heightened sense of well-being.
I know it sounds like a cliche, but it was like a miracle. After only a few visits, my pain disappeared. I've told everyone about my chiropractic experience.
Combined with other essentials like consistent exercise, good nutrition, and proper rest, regular chiropractic wellness care helps facilitate a healthy life, no matter what your age. Regular chiropractic checkups benefit children in a number of ways, especially for those with asthma and allergies. Consistent chiropractic checkups are as important as yearly physical exams. For older adults, regular chiropractic treatment eases the effects of arthritis, helps maintain balance for avoiding falls, and keeps the old noggin sharp. When it comes to good health for you and your family, preventing a problem is much easier than treating it. And it's a lot less expensive. Hey, thanks. When it comes to prevention, few things are more helpful, efficient, and complete while being less intrusive than chiropractic wellness care. Schedule a visit with our office today and discover the benefits of chiropractic wellness care for you and your family.
That was a great video that really shed some insight onto the nervous system and how important the nervous system is for our overall health.
Yes, it is.
And before we even talk more about the nervous system, I want to get back to what we were talking about with your insight on the chiropractic profession in our state, especially because you've been to so many different offices around the state.
Yes. There are definitely ones that I really enjoy going to, and surprisingly, actually, the ones that I enjoy going to are ones that I was actually afraid of going to, which is it's an open adjusting type of area. It's or clinic, that is, and with this, some are more open than others. Some are completely open, just tables next to each other. Other ones have a small little divider, kind of like your clinic, and the thing I like about it is that when you're, people stay on focus, because when you get into a room, sometimes people will end up wanting to talk about things other than their health, and that's fine and all, but again, next thing you know, 10-15 minutes goes by and not a whole, a little bit adjusting, and again, we get off focus. But when you stay in like an open area, it's like everyone kind of gets involved, because you'll say something about helping a child, with ear infections, or was scheduled for a tonsillectomy and found out that it got better on its own, didn't have to go through that trauma, and then somebody will hear it and go, oh, I have somebody that does it, and that would have never heard that if so. Absolutely.
For patient education, it's a great style, a great method of practicing, a great way to have an office set up, which is one of the reasons why I have it myself. One of the reasons why I have my office set up the way that it is, semi-open, is for one, people don't have to wait nearly as long. And that's a big pet peeve. There was a study done that showed the thing that people hate the most about going to any doctor's office is waiting. Right. And so I would much rather see people come in and get the care that they need rather than the care that they feel like they want to spend a couple hours on a day.
And there's one of the myths right there. They think that the more time you spend, the better care that you're going to get. And I felt that way too. But then I've actually went in there in these clinics and found out that that's not so. Because again, if you're focusing, you can get a lot done in 2 minutes. I mean, more so done in 2 minutes than you can in 15 minutes if you focus on the
And
right
with
thing.
chiropractic care as a healing approach, we remove pressure from the nervous system. We remove pressure from the spine, from the joints, from the discs, and specifically mostly from the nervous system. And we let the body does the rest of the healing. So most of the healing occurs over time through the body internally rather than us doing it. I always say to people that I believe that chiropractic works 100% of the time, every time, but I also don't cure anything. I don't cure people's bad backs, I don't cure their bad necks, I don't cure their kidneys, I don't cure anything. Right. If there's pressure whatsoever on the spine or nervous system, 100% of the time, every time, we will function better, we will perform better, we will heal better without that pressure. Am I curing their conditions? No. We're just removing interference, removing pressure so that the body can function at an optimal potential and heal itself at a better rate than it could before.
Absolutely. That right there is it in a nutshell. Sometimes we try to do too much. We sometimes, as the years go by in practice, I find that I do less and less, because you find that there may be one area that you want to adjust and let the body, again, we're letting the body heal itself. if you're going in there and you're hitting everything, adjusting, I say hitting, but when you're adjusting all these different areas, your body just sometimes gets confused. It doesn't know what to do, and it's a shock to the system. Again, I find that sometimes doing less is more. I also think that sometimes that we're not focusing on the right thing. Like somebody will come in with a certain pain and say, here, adjust me. Well, sometimes it'll be in alignment, and the problem is more than
compensation.
just
Like
right. It's a compensation.
A good example is I've had people with let's say plantar fasciitis, and that's on the very bottom of the foot. And oftentimes we'll just work on aligning the pelvis or part of the neck, and that will actually help alleviate the pain that's in their foot. And they won't believe how could this area affect this area. And
Right.
You've heard the old song, the knee bone's connected to the ankle bone.
Right.
We're all connected. It's all the organs are controlled through the nervous system, and our structure dictates the function. So we need to make sure the structure is in normal, healthy alignment, and that has a huge effect on the overall function of the body.
And also managing the case properly. If you're seeing somebody that really needs to be worked on more often, but yet they can only come in once a week, every other week, or once a month, they want you to do everything, because you only have that one shot to do it, and it's not always the best thing to do. Sometimes, like if you're seeing somebody a few times a week, you can work a little bit here, work a little bit there, see how the body responds to that, and you seem to get I find you get better results that way. If they're in for a maintenance type of care or wellness kind of a checkup, and if they're doing great, then that's the plan for them. But again, it's just managing the case properly. That is just as important, if not more, than the adjustment itself.
And the body can take time to do the repair and do the healing. And so what we see a lot is oftentimes people come in, and after one adjustment, immediately they notice miraculous results.
Absolutely.
And then other people respond a little different, where for them it may take months to get the results that they want, or the results that our goals are for them. And so we want people to realize and understand that the body is an amazing organism. It's an amazing structure. We have this amazing healing power, and it does respond differently for different people, and it does respond, the longer problems have been there, oftentimes the longer it will take. But oftentimes someone that's had problems for a long time, those are the ones that after just one adjustment can have miraculous results. But the body is a vitalistic organism, and it's not the same response automatically for everyone. We're not a machine, we're not a robot. We are interchanging constantly.
Right, you can have two people with the same problem, but respond completely different to the same technique, because we're all very unique. Our cause, we're focusing on the cause of the problem, not the symptom. And to do that takes a little bit more, a little more involved to do that. A lot more questions, a lot more insight. And again, people ask me, what causes my subluxation, where the bone's out of place, puts pressure on the nerve. That's, again, what we focus on. I says, well, I can't answer that to them directly because I haven't been with them, throughout the days to see what they've been doing. So I always say, well, here, go over the 3 terrible T's: traumas, toxins, and thoughts, or the autosuggestion. Well, stress is high with the economy like it is. I mean, of course, stress is going to be a part of it. Toxins, the food that we eat, the water we drink, or the lack of water. I mean, was it 94% of Americans are dehydrated? Report that I had read, and it doesn't surprise me. I mean, when I'm working with somebody, I can tell, you haven't been drinking enough water, have you? I mean, it's real obvious. And that's such a simple fix. I mean, we could save billions of dollars in healthcare costs if people just drank water.
And what they are drinking is soda, which is terrible for their body. The phosphoric acid is terrible for not only the teeth. They always say don't drink too much soda because that ruins your teeth. Well, it also affects the bones in the spine, the bones in the rest of the body. It's terrible. It helps break down our bone tissue. And so people are drinking soda all the time. The amount of sugar that's in it is causing severe obesity and epidemic throughout our country. And that's what most kids are drinking all the time.
Well, it's the sugar. And they say, well, I'm drinking diet. Well, that's even worse. It's the sugar that's killing us. We can go into a whole other topic on cholesterol and heart condition and cancer and all this, and it all points to sugar. I mean, we have more sugar in our systems than we should be. I mean, just for one can of Pepsi, 13 teaspoons of sugar.
Terrible. And people respond to sugar in different ways too. Sugar itself is a drug, and I'll touch on this real quickly before we wrap up our episode here. People respond to alcohol differently. So some people, after they have alcohol, they want to sing loud Irish songs. Some people, they fall right to sleep. Some people get angry and hostile. Children are the same way with sugar. Some children respond to sugar, they spike, they get some energy, and they crash. Other people respond with some of the symptoms of the ADD or ADHD type of symptom. Others, the sugar doesn't affect them at all. The sugar is a drug, and it affects different people differently, just like alcohol does. And so many people are constantly taking the sugar. It causes all sorts of different problems throughout our country because of it.
Oh, absolutely. I mean, it actually makes me sick, or it makes me ill to hear some families that they're putting their kids on Ritalin, and yet they turn around here, take this Ritalin here, take some Coke, and wash it down.
Yeah, exactly. It's like,
come on.
A little ironic, right?
And it makes me upset with the medical profession for not educating them properly on taking that. I mean, there's a time and a place for medicine, but there's so many times that I don't see that, where it isn't right, because they haven't done everything they can do to not be, to take those medicines.
So let's sum up a little bit. So I just want to explain one last time to our audience how important our nervous system is, and how important the nervous system is to our overall health, and how through chiropractic care we can maximize the function of our spine and our nervous system. And that's exactly what we do, and that's what we're going to do for people in the community. Thank you so much for joining us, Doc.
Thank you.
It's been a pleasure.
Same here.
Thank you for joining us on Ask the Chiropractor, your source for ultimate health, healing, and chiropractic-related information. I'm Dr. Adam Rodnick, and you guys have a wonderful day. Remember that God gave us the gift of life, and what we do with that gift is our gift back to God. We'll see you next time.